Hello and good afternoon, everyone. I'm Dr. Ishna Singh, presenting on behalf of the authors and ACMCRN. We would like to particularly thank the meeting chairs and committee for the opportunity to present our work in today's forum. Our abstract is entitled Harnessing Artificial Intelligence Machine Learning in Rare Diseases Living with Arachnoiditis. Arachnoiditis is a painful and rare disorder resulting from the inflammation of the arachnoid membrane surrounding the spinal cord nerves. Research on the symptomology, accurate diagnosis, and patient-reported outcomes in arachnoiditis is quite scarce, hindering effective treatment and management. Recently, artificial intelligence and cloud computing offer promise opportunity in rare disease research, enabling data analysis, pattern identification, and global collaboration. Between 2021 and 2022, the ACMCRN collaborated with the Stuffthatworks platform to implement a survey amongst our members, utilizing AI and cloud computing to gather what is, to the best of our knowledge, the largest patient-reported survey on arachnoiditis. We aimed this study at assessing treatment effectiveness, provide a platform for patient experiences, and to improve understanding of the condition. By leveraging technology and patient participation, the study sought to enhance patient care, treatment outcomes, and overall knowledge of arachnoiditis. Arachnoiditis is a painful and debilitating condition defined by persistent inflammation of the spinal cord arachnoid membrane, which closely wraps around the brain, spinal cord, and the spinal nerve roots in a spider web-like fashion. Damaging neuroinflammation in response to injury results in characteristic nerve swelling, scarring, and adhesions with thickening and clumping of spinal nerve roots, frequently progressing to neurologic deterioration and incapacitating sequelae. Arachnoiditis is an acquired condition in response to a variety of inciting factors, primarily involving either physical damage or chemical injury to the spinal cord or infection within the spinal meninges. Diagnosis is based on history, individual clinical findings, and MRI features. Symptom severity and MRI imaging do not always correlate, however. Here you see the hallmark diagnostic MRI imaging signs of abnormal clumping and irregular distribution of spinal nerve roots in the lumbar area. Clinical presentations vary, as does natural history and timing of progression. Arachnoiditis is considered a rare condition, but its exact incidence is unknown and likely underestimated due to the omission of subclinical cases. Individuals with connective collagen tissue disorders, such as those with Ehlers-Danlos syndromes, are well represented in the arachnoiditis community, as such individuals may have an underlying predisposition to develop arachnoiditis. Advanced stage adhesive arachnoiditis is characterized by intractable pain, significant mobility issues, myriad neurologic and multisystem impairment leading to long-term disability. Existing treatment interventions have variable results between patients and fall short, providing modest temporary symptomatic relief at best. Complications can extend to endocrine, genitourinary, GI, and autonomic nervous systems, leading to autoimmune manifestations and resulting in significant fatigue and shortened lifespans. Apart from its unrelenting neuropathic pain aspects, additional dimensions of isolation and suffering experienced by those with this condition are a part of the daily lived reality for patients with arachnoiditis. These additional unmet needs, which need to be better identified, characterized, and addressed, include long delays to diagnosis, averaging 4.8 years, with patients seeing an average of 7.8 physicians before an accurate diagnosis is made. Limited physician education and training, coupled with the inability to garner sufficient interest of the industry and the world of medicine for research, still remain challenges. Patients not infrequently reported dealing with the stigma of physician disbelief when reporting symptoms, with healthcare providers often looking for mental health issues or drug-seeking behavior to explain these. Diagnostic criteria are uncertain, even when MRI imaging shows clear signs, which have been published as hallmark criteria of the disease. 60% of MRI radiologists in one study failed to make the diagnosis. Finally, research into incidence, mechanism, and treatment is difficult due to geographical constraints and scattering of patients worldwide. Recent development of bioregistries, online patient advocacy groups, video conferencing, and big data advances are beginning to overcome the financial and logistical challenges to understanding and treating rare diseases that existed in the past. In arachnoiditis, for instance, AI machine learning with its image and pattern recognition might improve diagnostic accuracy in MRI interpretation. In our own group network, patients can engage each other internationally, find a collective voice, validate each other, and diminish the sense of isolation. The recent launch of our International Arachnoiditis Patient Registry is a cornerstone of our vision. We are confident that it will serve with the engagement of expert collaborators as the basis for future clinical trials and peer-reviewed research. To build the registry, we have joined forces with the Genetic Alliance peer platform in conjunction with Luna DNA for biorepository items. This slide visually summarizes the mission and outreach of ACMCRN, founded in 2017. The next few slides describe the result of our initial project. Between 2021 and 2022, ACMCRN implemented a series of health-related surveys within the international community, utilizing Stuffthatworks platform and disseminated via a combination of targeted social media campaigns and word-of-mouth strategies. Stuffthatworks is one of the several crowdsourcing platforms specifically focused on rare and chronic conditions with the aim of empowering people living with these conditions to transform their experience into an organized knowledge database. Individuals with the condition share information about themselves, experience their condition, its symptoms, and its treatments. Machine learning algorithms are then employed in an iterative process with stretch goals at each step to generate insights. After 100 contributors, insights emerge about age of onset, symptoms, aggravating factors, and treatments. After several hundred, it begins to be able to rank different treatments by effectiveness. And after thousands have responded, the algorithm can predict best treatments for the condition. Survey participation was entirely voluntary, confidential, anonymous, and online. After informed consent, participants were identified by only a code number for the duration of the survey. Participants provided current age, gender, age at symptom onset, and were asked to list their most common symptoms, aggravating factors, comorbid conditions, and to rank 34 popular arachnoiditis treatment as either tried, effective, or detrimental. Feedback on aggregate results and insights was offered to all participants at the conclusion of the project. 1,250 individuals living with arachnoiditis responded to the survey. 76% were females. 78% reported initial symptom onset in adulthood, as shown in the pie chart on the left. The pie chart on the right shows the current age of respondents, that is, their age at the time of taking the survey. As shown on the right, the most frequently reported symptom included lower back pain, leg pain, numbness, and a variety of other symptoms as noted here. Common themes of various types of overactivity, including lifting, prolonged immobility, change in position, as well as weather and cold temperature, emerged as the most common factors aggravating the underlying pain and neuropathic symptoms as shown on the left. The graph on the right shows how survey respondents rated most common popular treatments for arachnoiditis as either tried in yellow, effective in blue, or detrimental in red. It is interesting to note that the same treatment was frequently rated by different respondents as being either effective or detrimental, an indicator that there is a variability in how different individuals may respond to a given treatment. Also of note, one can see that the treatments ranked as most effective in blue were rated so only by 20% or less of the respondents, indicating a need for more effective treatments. The graph on the right singles out interventions or factors ranked as detrimental, myelograms and epidural injections being foremost amongst these. Arachnoiditis was found to be highly correlated with the symptom difficulty sitting. The strength of this correlation suggests difficulty sitting might serve as a unique marker for arachnoiditis diagnosis in the future, which merits further study and validation. In summary, this early attempt at employing AI machine learning software platform to indicate that traditional burdens of recruitment in rare disease may be overcome with the use of virtual software. And when combined with the recruitment potential via disease advocacy and support groups, it exceeds past traditional attempts to recruit a sizable cohort. These findings will be expanded upon through our patient registry in upcoming studies. You can find more registry information at our website, www.acmcrn.org. For any potentially interested future collaborators in this audience, this slide summarizes the key goals of our newly created patient registry. The authors wish to thank all the ACMCRN members who participated in the survey. We acknowledge Stuffthatworks for the use of their platform, data aggregation, and insight analysis. We're grateful to Lou Cipher and to E. Blackburn for graphic design support and poster preparation. We would like to dedicate this presentation to the memory of ACMCRN co-founder and former VP of Research, Terry Lewis, PhD, who provided vital input into the concept and design of this study. Thank you for your attention. Be sure to also visit our poster during meeting breaks. Note the QR code at the bottom of the poster, which can link you to a live Zoom meeting room where one of the authors will be standing by remotely during each of the poster viewing times to welcome your questions. Thank you.